Okay, I'd like to report on a paper which I think is quite interesting because it has a 40-year follow-up. It's a paper by Tia Cummings and a team from Australia, Melbourne, and they report about a 40-year follow-up of cognitive functions of people after traumatic brain injury. And the message, which will come up later, is quite impressive in my view. Anyway, so over the years, there have been people who were fighting in Vietnam. They are Vietnam veterans, and what they looked here were 29 people who were from normal controls and 40 with traumatic brain injury. And the question is, what happened over the years and what the cognition? So the question is whether traumatic brain injury at time of service later, 40 years later, leads or contributes to traumatic brain injury and cognitive decline. Right, okay, so they have a sample, and I'd like to go to the sample straight away. So ex-military personnel now aged 60 to 85. And there is a control cohort, which is quite comparable. So this is the control cohort, which I think that's the first. Let's go with the tables. This is the definition of Department of Defense brain injury severity. So there is a question of mild, moderate, severe, and the question is how long is loss of consciousness, alteration of consciousness, the Glasgow Coma Scale, structural imaging, or any differences. So this is a scale. And they're mild, moderate, and severe. And so the question now is coming back to the control. These are the veteran healthy controls. And from this aging study, Australia, imaging and biomarker and lifestyle aging study. So these are the healthy controls, and they are quite comparable. So there's nothing very much different. So it seems that the healthy controls they chose are quite comparable to the representative healthy controls from this other study. Right. Okay. So in the patient sample, which are 40 people now. So what are the traumatic brain injury? What are the causes? So they have falls, penetrating shots, blasts. Then they have motor vehicle accidents and sports. The interesting part is that sports is the most common cause for traumatic brain injury in veterans when they were young. Right, okay, so that's the one thing. So now we have these healthy controls and the traumatic brain injury. So let's say it that way. They're more or less comparable. The TBI, the people with TBI are slightly less younger, and they have the medical history is more or less the same, a bit more severe. The people with TBI are a bit bigger, but that shouldn't affect the story too much. Right. Okay. So what are the psychiatric data? So yes, people with TBI or traumatic brain injury have more mental health problems in general, and this seems to be quite consistent with most of the disorders, including depression, somatization, OCD, and others. So then now we come to the cognitive domains, and usually the general function of the cognitive domains, that's the raw data. So we have mini-mental, MOCA scores, and learning executive function, language, attention, and processing, attention and processing. So there are some differences, but coming to the main differences between the cognitive domains, and this is normalized. So the question is that people with mild TBI, so let's say that's normalized, and compared to the normal people with mild cognitive impairment, their variance or whatever their difference to the controls is more or less within the confidence interval. So let's say these darker ones, they have no major differences between healthy controls and themselves. So there isn't any major cognitive impairment. But the ones with severe trauma, they have significant differences to controls. And this is Z scores, and so memory and learning is worse in people who had traumatic brain injury, and the same applies for attention and processing. But the other cognitive function, there doesn't seem that much of a difference. So what do we learn from this? So even after 40 years of life, you can see that people with severe traumatic injury, brain injury, which was about half of the population, or I think 15, they had severe cognitive impairment, even 40 years after follow-up. So the conclusion is more or less there are long-term sequelae of traumatic brain injury, and they are usually in the specific functions, but not in general. So that's an interesting paper, and I hope you learned about that. If you want to read the paper fully and with all the complex or clarity of explanation, then please check www.globalpsychiatry.co.uk. And if you want to hear more of these explanations, short explanations of the essentials of papers, please subscribe to our website, Global Psychiatry Archives, or the YouTube website, Global Psychiatry Archives. Thanks for your interest and have a nice Sunday. Okay, bye-bye.